What makes our AcuVision Recovery Program different than what other doctors offer? Well, we can start with conventional eye doctors because for a lot of these conditions, there's not too much to offer. And even if there is something to offer, it's very limited. Okay, so for macular degeneration, for retinitis pigmentosa, even for cases like glaucoma. Okay, so with glaucoma, you may get eye pressure lowering medications or surgeries, but guess what? Your optic nerve is still stressed and degenerating. So without doing useful strategic tools, implementing these tools to help with the health, function, integrity of the optic nerve, it's just going to continue to get worse and your vision is going to decline. With macular degeneration, okay, so there's ARIDs or some supplements they recommend maybe omega-3 DHAs, but there's not too much, all right? And they don't even really know what causes it, right? You ask your ophthalmologist what caused macular degeneration, they're going to tell you your old age, bad genes, or they don't really know you got bad luck. When it comes to other conditions like Stargardt's, Usher syndrome, retinitis pigmentosa, some of these genetic conditions, that's pretty much what you're going to be told by your doctor too. Oh, it's genetic. Okay, which may be true. You may have family member or they may have found a gene that's associated or correlates to your condition. But that does not explain what's going on. That doesn't explain the mechanism of action. It doesn't explain why your body is breaking down. So we understand exactly what's going on with most of our patients' cases, which is why we're able to get the results we get in terms of both vision recovery and long-term preservation. So the tools that we use are safe and natural. They'll never, ever, ever cause side effects or harm, negative side effects or do harm. A lot of the conventional treatments can, whether it's the medications, the injections, the pharmaceuticals, or the procedures, there can be a risk to those. And you can end up in a worse place than where you started. We've seen that quite a bit. There are other practitioners, of course, that do holistic methods. We try to bring it all together, right? There's some people do acupuncture, some people do alternating current stimulation, some people maybe do red light therapy, some people do vision therapy. We bring it all together. So we do everything in our clinic that I found that is safe and effective and useful for people dealing with these types of conditions. And if it's something you are interested for yourself or a family or loved one, please feel free to reach out to us to find out more about the services and products that we offer. You can also go to our website, www.eyehealthinstitute.com, or feel free to call or email us to find out more so we could actually find out more about your situation, or if it's a family or friend, and figure out what we can do to help. We don't accept all patients. That's why we screen them. If we don't think we could help, we tell patients that or prospects that we can't. We do a good screening process. So if I think I can help, then we'll make our recommendations, whether it's at home with telehealth and supplements and using some of the tools for home, or if it is a better idea to have you come in for clinic, if that's possible, for a 1 or 2 week stay. Dr. Andy Rosenfarb here with AcuVision. Your vision is our mission. See you soon.